Let's turn from there to the third of the fatal four. Bengal, confirmed number of cases 1456, recovered 364, deaths are 144, fatality rate 9.89%, well above the national average. Now, all of this, of course, coming at a time when there is a tug of war between the center and the state over COVID. The ruling TMC, the BJP at the center, locking horns over alleged numbers of coronavirus cases. BJP accusing Mamata government of fudging the numbers. Mamata saying the center is targeting her. Take a look.
Big political war between the TMC and BJP over number of COVID-19 cases in West Bengal. After being accused of hiding COVID cases and fudging death figures, Mamata government has now divided the data into two categories: cases with both COVID and comorbidity and those with just coronavirus. The centre maintains that 144 people have died in Bengal due to the virus till May 6th. But the state government says that only 72 people died of the virus and 72 others died due to comorbidity. The state also pegs the number of cases at 1,047 against centre's tally of 1,456. The BJP hit out at the Mamata government over highest mortality rate in India, which according to the Interministerial Central Team is 12.8%.
दुनिया में सबसे ज़्यादा देश में 4-4.5% है, दुनिया में 4 से 6 से 7% है, यहाँ 13 से 14% है मृत्यु दर. क्यों? इसको छिपाया जा रहा है.
The TMC meanwhile has given a strong rebuttal, saying that centre is maligning state machinery.
ऊपर से आप पीपीई मांगो, 100 मांगो तो 5 दे रहा है, आरएनए एक्सट्रैक्टर मांगो तो नहीं दे रहा है, आप मशीन मांगो तो नहीं दे रहा है, किट मांगो तो नहीं दे रहा है, कुछ भी नहीं दे रहा है और हमेशा स्टेप मदरली एटीट्यूड करते जा रहा है. ऊपर से यहाँ का जो माइग्रेंट लेबर है उनको भेजने के लिए भी बोल रहा है कि रेल का पैसा तुम दो.
So what are the real COVID numbers in West Bengal? Is the Mamata Banerjee government fudging numbers, or is BJP unfairly targeting the state? Is it all related to the state polls next year?
The pandemic has brought the entire world together but could not get the central government and the state government on the same platform. Call it the difference of opinion or the political rivalry, the differences are here to stay and out in open too. Even if the doctors have been complaining or the rivals which have been blaming, it is of course just beyond any battle could have ever been. With camera person Tapas Behri, this is Manogya Loiwal in Kolkata for India Today.
And joining me now is the firebrand TMC MP, Mahua Moitra, now joins us. Mahua Moitra, let's be honest, is West Bengal living in denial? It's only in the last week that suddenly the numbers have shot up. Till a week ago, Bengal claimed that there were COVID-19 cases were in single figures. Suddenly, if I add the comorbidity cases, which your government is not, you're up to 144 and your mortality rate is now almost 10%. Are you in denial?
No, Rajdeep, Bengal has never been in denial. Today, we've got the most robust and accurate reporting on data of the data. I was just listening to the person with the voiceover before this, and they said that apparently we are reporting 1,000-something cases, where the government of India is reporting 1,456. I think that's completely wrong. I have with me today's statistics from the government of West Bengal, which is put up on their website, and the number is the same number that you have as the government, which is 1,456, which was till the 6th of May. Today, 92 cases confirmed, total confirmed 1,548. There has been absolutely no discrepancy between the numbers that you have and the numbers that the government has put out. So that's something that's factually incorrect. Initially, and even till today, you will find that there has been a discrepancy in numbers between the ICMR numbers and the Ministry of Health numbers at the Government of India level as well.
There was a discrepancy between also, Mahua Moitra, the way the Bengal government was defining a COVID patient and was claiming that comorbidity should not be lumped with COVID patients.
No, Rajdeep, we have put it out very strongly here today, and it says we've got number of deaths due to COVID 79, total number of deaths due to comorbidity 72. There is no hiding. So if you add the two together, you get 151. If I look at the Gujarat, I just went on the Gujarat website, the COVID website for the state of Gujarat. It says press note dated today, number of deaths in Gujarat last 24 hours due to COVID 15, due to comorbidities 34. Gujarat is reporting in exactly the same way. You can add it together. So why is Bengal being targeted for it? If we were not hiding the comorbidity, if we were hiding the comorbidity number and just putting out the COVID number, I could see you have a point. But given that the government is very clearly putting it all out, so I don't think there's an issue with that. I mean, even Gujarat is reporting in exactly the same way. And how come you're not picking on them?
The charge, Mahua Moitra, the charge that the MHA makes in their report of the two interministerial central teams who visited West Bengal, gaps in surveillance, contact tracing of positive cases. State has not provided data of the number of households contacted and surveyed for the signs of COVID symptoms and under testing. This is now a central team which has put out this report which the MHA has sent to your government. Is there under testing? Will you concede compared to a Maharashtra or even a Gujarat? You are under testing.
Okay. 1 second, Rajdeep. Our testing numbers, our testing numbers have gone up 10x in the last week, and they will go up a further 10x. And there are two reasons for this, and we have to understand this. In the beginning, Bengal did not have the number of cases in spite of a density population in Calcutta. We have less urban centers than, say, Maharashtra or Delhi. Because of that, our numbers initially were less. So when we asked for rapid testing kits and we asked for accreditation of labs, they were much slow. We couldn't do it without ICMR. ICMR guidelines in the beginning were that if you're asymptomatic, you do not test. We followed those guidelines. We did not get accreditation for our labs. We were sent faulty kits. In the beginning, we sent in a request for 95,000 kits. We were given 10,000 kits. Even today, the government has put out on their website, equipment ordered by the state government, PPEs, 16.5 lakhs. Total received, 6.3 lakhs. Order pending, 10.2. So if you say our doctors are not getting PPEs, it's because the central government hasn't been sending us. N95, ordered by the state government, 29 lakhs. Total received, 3.3 lakhs. Pending, 25.7 lakhs. So a lot of the problem stems from the fact that the center is actually holding on to all of the supply chains. And the bottleneck at the state level is coming from the center. There's nothing to hide here.
No, you're saying you're virtually blaming the center, therefore, for whatever has gone, whatever criticism is being levied against the West Bengal government, the West Bengal government, whether it is under testing, whether it is lack of surveillance, you claim all of this is center's propaganda.
I don't think, no, I think that the truth lies somewhere in between, Rajdeep. I don't think the truth is black and white, is all of that. I do think that we've been unfairly picked on completely. I mean, if you look at the ICMT letter, and we've all gone through it with the tooth comb, there's nothing constructive in that letter. The ICMT letter, the letter from the Home Secretary to the Chief Secretary is made public to the media 2 hours before the Chief Secretary even gets it. Now, things like this don't really add up. I mean, you've got UP with a terrible problem, which is a much worse problem than ours. You've got MP with a much worse problem than ours. There's no denying it. I mean, Gujarat reporting exactly the same way. But because of political considerations, I do think Bengal has been picked on. But having said that, were there some lacunae in the beginning? Yes, there were. I'm not going to try and defend the indefensible. There were. But have we sorted it out and have we come out? And today, do we have the most robust reporting? Yes, we do.
Are you therefore fearing that it could get worse? Are you fearing that it could get worse in Bengal as the testing steps up? The numbers could get worse, and does Bengal have the infrastructure to handle high numbers?
Okay, two separate answers. The first is that, do you think that as the testing numbers go up, the fatality rate will obviously go down, because the testing number is a low denominator and the number of deaths is 151. Is because you have a double-digit fatality rate. The minute your testing number, the denominator goes up, obviously the number of the active cases might go up, which is fine, but the number of fatalities percentage will come down. So the second thing, does Bengal have the infrastructure? Yes, we do have the infrastructure. If you see our numbers, again, we've got 68 dedicated hospitals. Every district has a dedicated COVID hospital. We've got earmarked COVID beds of almost 9,000. We've got ICU beds of 907, government quarantine centers. All of that is there. Now, one problem that we have along with Bihar, along with Orissa, is we're an outward migrant state. So if we've got 10 lakh migrants outside, and if they were all to return to the state, then that is obviously some overwhelming problem that we would have to face, because you saw, for example, in Orissa, 20 people came back from Surat into Orissa and they're COVID positive. So this is something all outward migration states are going to have to face in the next few days, and it just depends upon the numbers, Raj. Okay. This is a disease, we can't second guess it, but we're as prepared, and I think that Bengal today,
and therefore in conclusion, all the charges that Bengal not following social distancing norms, that Bengal has much higher relaxations of the lockdown than other states. All of this you are saying is all part of a propaganda war, is it?
Yes, I do think. I think in rural areas all over India, given that it's a green zone, that relaxations have come about in order for agriculture. And Bengal, you have to remember, it's an agricultural-based state. It's not an industrial state. It's an agricultural state, and agriculture got relaxations very early on. So as a result of which, it does seem as though rural Bengal has sort of come back to life before other places. But that's the nature of the geography and the nature of the livelihood in Bengal. So and as far as Calcutta is concerned, Howrah is concerned, I think the lockdown is being very strictly enforced. I mean, as strictly as it is, for example, in Delhi or anywhere else.
And you deny the charges that some doctors' associations are making from time to time, that the Bengal government is not providing them the facilities or is fudging the figures, right? It's not just the center.
Rajdeep, look, I mean, if doctors say they haven't got PPEs, that's something that even in New York you're getting, right? I mean, like I said, we can't manufacture PPEs in our backyard. If we've ordered 16.5 lakhs and we've only got 6 lakhs today, right, then that's not something we can do. There's obviously we can't give out more than we've got. So that is something that, unfortunately, the center gives us what we want, that we're going to have to live with. But apart from that, there has been India is not a country where you can hide mass deaths, Rajdeep. You know that.
Okay.
If there is a death today, then a death has to be reported. So I don't think Bengal is sort of lax in anything like that.
Okay. As always, Mahua Moitra, appreciate your joining us and talking straight. Thanks very much for joining me and giving the Bengal government perspective.
Hello everyone, this is Rahul Kamal here. Hope you enjoyed this video. For the latest news and analysis, like and subscribe the India Today YouTube channel and don't forget to press the bell icon to stay updated.